Welcome everybody. With you Dr. Magdi Abdelrazik, consultant of infectious disease, hepatology and gastroenterology. Our topic today about paraneoplastic syndrome. This syndrome occurs before cancer, and this syndrome usually occurs in middle age and old age. In some types of cancer like lung cancer, ovarian cancer, lymphatic and breast cancer, also in testis cancer. This paraneoplastic syndrome usually due to abnormal immune response. Antibodies and T lymphocytes, instead of affecting the cancer, it by mistake affect neural cells, and sometimes this manifestation like sensory affection, especially in lower limbs, loss of coordination, dementia, hallucination, vertigo, speech disorder, sometimes sleep disturbance. All this manifestation is usually neurological manifestation of paraneoplastic syndrome. Some of the patients suffer from spastic muscles we call it stiff person syndrome. And sometimes the patient suffer from severe weakness in the muscles, and sometimes we call it myasthenia gravis or Lambert-Eaton degeneration syndrome. Sometimes the patient complain of brainstem encephalitis or cerebellar degeneration. Sometimes the patient suffer from oculomotor dyskinesia, or the patient sometimes suffer from dermatomyositis. Some patients suffer from hypoglycemia or hypotension or anemia or hypercalcemia. Some patients suffer from Cushing syndrome or inappropriate antidiuretic hormone. Some patients suffer from skin manifestation like deep skin manifestation, darkening of this skin. So we have to diagnose this condition by CBC. Sometimes we make CT scan on the brain or on the chest or on the lung or on the abdomen. Sometimes MRI. Sometimes we make PET scan all over the body. Sometimes we make lumbar puncture in some cases. Also, we have to make also hormonal assay to discover any hormonal disorders. What about the treatment? The treatment is to discover the cancer place and treat it. So by surgery or radiology or by chemically. Sometimes we give the patient corticosteroids. Sometimes we give cyclophosphamide. Sometimes we give azathioprine. These drugs usually suppress the immune system in the patient. Sometimes we make plasmapheresis. Sometimes we give immunoglobulin to suppress the immunity of this patient. Very important to diagnose paraneoplastic syndrome to avoid cancer and metastasis. And also this paraneoplastic syndrome manifestation, if we discover it early and we treat cancer, so the patient will improve. But if we do not diagnose paraneoplastic syndrome, this means that we will not diagnose the cancer, and the paraneoplastic syndrome will increase, and the condition of the patient will deteriorate. Very important to know that paraneoplastic syndrome sometimes misdiagnoses with neural disorders like fibromyalgia. Many patients, we diagnose it as fibromyalgia by mistake, and take the medication of fibromyalgia, and the patient, after that, we discover that the patient has cancer, and the correct diagnosis for his condition is paraneoplastic syndrome. Sometimes also we diagnose the patient as familial Mediterranean fever, and we make the chromosomal study, we will find it negative, and some doctors give colchicine to the patient. The patient sometimes improve, and his muscles and the joints improve, and the abdominal pain improve, but the diagnosis is incorrect. It is maybe paraneoplastic syndrome, and there is misdiagnosed as familial Mediterranean fever with negative chromosomal study. So it is very important to diagnose the patient correctly. So take care from fibromyalgia and familial Mediterranean fever with negative chromosomal study. Sometimes we diagnose the patient as rheumatic fever in old age. Also, this diagnosis mostly incorrect, and we have to know why this patient suffer from arthritis or arthralgia and myalgia. Some patients say that all the body with pain, all the muscles painful, my bones painful, severe arthralgia. So we have to remember paraneoplastic syndrome, and please do the investigation and search for cancer. This is very important. Thank you very much.